Hello, I'm Dr. Rohini, a consultant working in Vardhan Fertility Centre. Today I'm going to talk about IVF procedure, that is in vitro fertilization. So when a patient comes to a fertility center, first they go through step by step a lot of processes like ovulation induction and intrauterine insemination, that is IUI. In case the couple doesn't conceive despite these procedures, they go to a much more advanced procedure that is called IVF. So when you come to our clinic, first of all, we would be doing a bunch of hormonal tests for you, and then these tests are usually done on day 2 of your cycles, and then we would be doing an ultrasound to see your egg reserve and how your follicles are. And once we get the reports, we would be starting you on certain injections, that is FSH and LH injections. So these injections are given to increase the size of your follicles which harbors the egg. And our motto in IVF is that we harvest as many eggs as possible in a single cycle. In a normal woman, what happens is per cycle only one egg is released. But in this case, we are taking the whole cycle in our hand, and artificially, with the help of hormonal injection, we are trying to harvest as many eggs as possible, and thereby increasing her chance of conceiving faster. So we would be giving injections for 10 days. So once you come on day 2, we would be doing the scans, seeing the results, and starting on injections, and probably we would be calling you on fifth day of your stimulation. Stimulation, that means the day from when we have started the hormonal injection. So usually that is fourth or fifth day of starting injection, and then we would be doing a scan and seeing whether the follicles are growing well according to the time. In case we feel that there is a problem and the follicles are not growing, we will be increasing the dosage of injection, and if everything seems fine, we will be just continuing with the same dosage. Usually what we have noticed that around 9 to 10 days of injections are enough to for the maturity of the follicles. And when we would be again calling you on 9th or 10th day, and we would be doing a scan, and when we feel that the follicles are big enough, that is they are around 18 to 20 in size, then we would be giving an injection called HCG injection, that is the trigger injection. This injection basically helps in the rupture of follicles or release of egg 36 hours after the injection. And then we would be doing a procedure called oocyte pickup procedure. This is done under sedation, and then we would be inserting a small tiny needle in through the vagina, and we would be collecting all the eggs. And then these eggs are aspirated, and then they are handed over to the embryologist, and then that is frozen. Now the decision is taken whether next, after these eggs are taken, a procedure will be done called ICSI, that is intracytoplasmic sperm injection, in which we would be taking the best quality sperm from your husband and injecting it directly into the egg. Now, after this, the egg will be grown artificially outside, the embryo will be grown artificially outside, and we would be checking it after 48 hours and again after 72 hours and after day 5. So now there will be a decision has to be taken whether the embryos have to be transferred in the same cycle or in the next cycle. In case the embryos are transferred into your uterus in the same cycle, it is called fresh embryo transfer. Now, this decision will be taken based upon your hormonal profile and the thickness of your endometrial, that is the lining of your uterus. In case if everything seems fine, we would be transferring in the same cycle. In case if the hormone levels, that is the estrogen levels, are very high, or if we feel the endometrium is not thick enough, in that case we will be freezing your embryos. They will be kept in the embryology lab, and then we would be giving you a break of a month or two, and then we would again call you back on your second or third day of periods. On that day we would be we would be doing a scan to check the thickness of your endometrium lining, and then we would be starting you on certain medications, that is hormone replacement therapy, where we would be giving estrogen hormone to increase the thickness of endometrium, and then we would be following up, and when we feel that the thickness is more than 8 we would take the decision to transfer these embryos. Now, the embryos are of two types. There's a day 3 embryo and there is a day 5 embryo. The day 5 embryo is called the blastocyst. This decision to transfer which kind of embryos will be taken along with the embryologist, and usually day 5 embryo is considered a high quality embryo, but then again, depending on your situation, your lining and your hormonal status, we would be taking that decision, and then the embryo transfer would be done. So in case if it is a day 3 transfer, once we feel that the lining has come up, we would be giving you progesterone injections or tablets for a period of 3 days, and then we would be calling you back for the transfer. In case we are going to do a blastocyst transfer, that is a day 5 transfer, in that case you would be given injection for 5 days and called back. Now, embryo transfer is not a painful procedure. Usually, that does not require any sedation, and it is done under the guidance of an ultrasound. We would be taking a small cannula through which your embryos will be injected into the uterus. Now, after the procedure, you do not require any kind of bed rest. You can do your day to day activities. We would be giving adequate progesterone support that will help for the baby to grow inside the uterus. And then this usually these tablets and injections are given for a period of 2 weeks, and then after that we would be calling you back and we would be doing your pregnancy hormone test. It's a blood test, that is beta hcg, that would give us an idea whether you're pregnant or not. So this is basically how an IVF procedure is done, including the oocyte pickup and the embryo transfer. Usually this happens over a period of 2 to 3 months. If everything goes well, you would be conceiving with your first cycle. If there is some added complication, if the age of the woman is more than 35 years, or if there is any disparity or any problems in the sperm count, in that case it may go beyond the first cycle, and you may require some extra added time. This is a basic information that happens during the IVF process. In case if you have any further doubts, please feel free to come and visit us at Vardhan Fertility Center. Thank you.